the disease with 1,000 faces. Difficult to diagnose, complex, and chronic. It will strike 1 in 900 Canadians. Lupus. This autoimmune disease alters patients' lives, and if left untreated, can be fatal. At the BC Lupus Society, we provide support to people living with lupus. Because lupus is unpredictable, we strive to be dependable. Our programs include weekly support groups for patients and families in British Columbia. We make sure that educational resources and peer contacts are always available, including for patients facing a new lupus diagnosis. And every year, we help fund clinical training and medical research that benefit people with lupus. Through the BC Lupus Research Scholar Program, our goal is to advance treatments and discoveries to change the future of lupus. Our partnership with university researchers is unique in Canada and has helped understand the full impact of lupus and the effectiveness of lupus care. As part of our community, you're a valued part of annual events like our Lupus Gala and the Shed Light on Lupus Walk. These fundraising activities generate just part of the funds needed to sustain our work in patient support and medical research. With the generous support of donors like you, the BC Lupus Society will continue to be here for patients and families affected by lupus. Not only can we change tomorrow, we can brighten today. Thank you from the BC Lupus Society.
Hi, everyone. I'm Dr. Jennifer Reynolds, and I'm the director of the Lupus Clinic at the Mary Pack Arthritis Program. And I'm really happy to be present again for another year of the BC Lupus Symposium. I'm going to switch gears a lot this year and talk about something that I think is new and not yet ready for prime time or clinical use, but something I think is going to be super useful in the future. So today I'm talking about the potential to use machine learning in lupus. And I don't profess to be an expert at all in machine learning, so I'm not going to go into a lot of details, but I do have a couple of references at the end. I did run it past my son, who is a local expert in terms of machine learning. So as an overview, I'd like to talk about what is machine learning and how it could help with lupus. There's a possibility for faster diagnosis, for better detection of flares, to predict response to treatment, and to predict prolonged remission. Machine learning is actually a subset of the field of artificial intelligence as a whole, and I think probably most of us have heard about this in the news. It seems to be quite a buzzing field. Basically, at the most bare bones level, it involves computer programming with statistical algorithms to learn from data and generalize to unseen data. So with the concept that over time that the program learns to do things better. Some real world examples and things you might have heard about are automatic translation using virtual personal assistants, things like Google or Cortana, image recognition, email spam filtering, huge number of spam emails coming through that get filtered out by these algorithms, search engines in general in terms of what they're putting forward as your top search, online fraud detection, and then in the bottom right there is medical diagnosis. And I think some of this is already being used in real time. So machine learning is the subset of AI that looks at different techniques or programs in order to look at data in a different way. This is a slide off of the internet, so it's looking at different approaches. Supervised learning uses training with labeled data, and we do see some of that being used in lupus applications where patients, for example, would be classified into one disease or another, one set of massive manifestations or another. Regression to a line is fitting data points along to a line, and that's useful in a lot of different applications. Unsupervised learning, I think, is really exciting, and so that's where the model actually develops associations or clusters that we might not know ahead of time, and so that can bring out new ideas or ways of looking at our data. And then reinforcement learning, we haven't really seen as much being used in lupus. So in this little cartoon, Basically, the dots and the triangles represent the training data. So in most machine learning models, there's a huge amount of training data that develops the models. And then the yellow stars are representing new data, which you can predict in the trained model. So the trained model of classification will predict the yellow star as part of the red triangle group and not part of the blue circle. Very basic. In terms of lupus, there's been a lot of different studies done to date, though most of them are still in the research realm, not yet ready for prime time, as I mentioned. There's been studies looking at improving the diagnosis in lupus patients, in predicting lupus flares, in predicting remission or rejection from renal transplants, and then in improving prognosis overall. The inputs that they're using for these different programs are hugely varied, ranging from genes and genetic testing of patients, and there's large groups for that, to gene expression, which is where you're looking at what genes are actually being translated into proteins. And so it's much more of a real-time assessment of what genes are being used, the proteins themselves, the lipids that are being formed. And then there's other studies that just look at electronic health data or chart data. So a huge amount of variability in terms of the data inputs and therefore the questions that you can answer. So if we look at diagnosis, for example, there's lots of reasons why there's a delay in lupus, and this has been well documented. Some of it's disease related. So we have a relapsing remitting disease, and so sometimes patients, especially early on, might have mild symptoms that go away and they don't seek medical attention, or they're just really a slow accumulation of symptoms. As well as for physicians, sometimes it's really challenging at the onset to distinguish what specific diagnosis is going on. Things like fatigue or joint pain can fit with a variety of different diseases, and it might not be clear at the get-go what specific disease the patient has, particularly with lupus. There are lots of system-related delays, though, and I think we're getting a little frustrated with this in our medical system. There's delays to see a family physician. Many patients don't have a family physician, and then there's delays for referral to the correct specialist to make the diagnosis. So some studies looking at machine learning lupus diagnosis have looked at those sort of generating idea things in terms of differentially expressed genes. This isn't just the genes in the genome, but the ones that are being expressed. There's one study that found 6 candidate biomarkers for lupus using those genes. A different study looked at a model of genes from genome-wide associations, really all of the genes that are present in different populations, and that was also predictive. So individually, each genome-wide association really doesn't give us much of an increased risk from the regular population. But when you put all of those associations together, you can start to make some predictions. Another study looked at gene expression and then a change in the way those genes are expressed in terms of DNA methylation, which is just a chemical processing of the genes, and they could distinguish lupus from Sjogren's syndrome. So this was an extra add-on. So sometimes early on, Sjogren's and lupus can look a lot alike. Some patients have both, so that would be more complicated. But there is some machine learning models that could help us to distinguish those two. In terms of studies predicting subtypes of lupus, this has been quite widely discussed in the lupus literature. We talk about lupus as a disease of 1,000 faces, where everyone's lupus is slightly different in terms of severity, in terms of triggers or flares, in terms of organ involvement in response to medication. And some of the machine learning models can use clinical and lab data to help us describe smaller clusters or specific groupings of these patients. So one study found two distinct groups with active disease more present in one group, but kidney disease more in others. So if you could put patients into those two groups, you might be able to reassure one group that they had less likelihood of having kidney disease. Another study actually found 7 clusters with higher disease activity, clusters 3 and 4, but more kidney disease in cluster 4. So even though cluster 3 might have high disease activity, didn't worry so much about the kidneys. And then in terms of clusters 2, 5, and 7, it was actually really rare to have kidney disease. So that would be really reassuring. I personally find that there's so much variety in lupus patients that I wouldn't be surprised that we need at least 7 clusters, if not more, to help to really break down how patients are grouping In terms of predicting flares, currently, when I see my lupus patients, I'm getting them to do blood and urine tests every 3 months, or sometimes less or more, depending on how active the disease has been. And then always we rely on our lupus patients to tell us their symptoms. But sometimes that really doesn't give us much advance notice until there's actually a flare going on. So one of the machine learning studies looked at proteins made by white blood cells, which is cells that we can take from a regular blood draw. And they developed an algorithm that looked at protein combinations. And they found 6 proteins that were helpful to diagnose lupus. And then more interesting to me, 9 proteins that were actually helpful to predict flares of lupus. So very promising in terms of we may be able to get more information from the tests that are already being done. One of the big things we worry about in lupus patients, obviously, is the presence of kidney disease. I've talked about it a little bit, but there was actually a machine learning model that could distinguish between 2 different classes of kidney disease. And this is clinically sometimes really difficult, but distinguishing class 3 and 4 from class 5 actually is really important in terms of how aggressive we are in treating the disease. And in fact, some patients with we could be sure that they only had class 5 might not need a renal biopsy at all. This also gives me hope that they may be able to distinguish the subtypes of kidney involvement without a biopsy going forward. Another big area for lupus patients is arthritis. And fortunately for most lupus patients, arthritis isn't actually damaging or erosive, whereas rheumatoid patients, for example, have much more erosive arthritis, lots of damage or holes in the bones. But there are some lupus patients who do have more aggressive arthritis, and we would like to be more on top of things in terms of treating their arthritis. And so there was one of these machine learning models that actually brought up a new protein antibody that is associated with arthritis being more damaging. And so this isn't something that we can measure currently, but it's obviously potentially a new marker that we'd love to have access to. In terms of predicting response to treatment, this is always a bit of a struggle. There's different medications that have been studied kind of individually. We don't have an overall prediction at this stage, but rituximab has been shown to be less effective in patients who have what we call an interferon low, so specific protein being low, but high neutrophils, so a different white cell count high. So those patients actually had a lower response to rituximab, and we might want to pick a different medication to treat those patients. Sometimes the duration of therapy is a little bit challenging. So there's a study looking at sirolimus, and they showed a better therapeutic effect if you maintain those levels in quite a narrow range, but for a long period, for 6 to 12 months, you had a much more long-lasting benefit for those patients. And then there was another study looking at one of our newer molecules, not yet available in Canada. Talk about why we don't have access to all of these new biologics, but tabalumab is a medication that's potentially going to be useful for lupus patients, and one of the machine learning models developed a complex algorithm actually to predict the likelihood of response, which might make this medication more available to those patients who have a higher likelihood of responding to it. And then the final machine learning program that I wanted to touch base a little bit more in depth is something called Micro SLE. It's an omic-based workflow, so that means it's looking at the proteins that are being produced by lupus patients, and it's a whole panel of proteins. And it sort of gives you this molecular portrait of individual patients, and it's supposed to be useful to support our decision-making, therapeutic decisions. I think the wording on here is a bit too wordy. It's easier to see in pictures. But what they did was they had 9 different lupus cohorts. So those are just groups of lupus patients at various centers around the world who have already done gene expression profiles of their patients. This wasn't done in real time. This was data that had been collected usually for other studies. They took all that information and they put it into a model, and they calculated something they called an M-score. But basically, they then scored the various different gene expression profiles to create these 206 lupus relevant modules. And then fortunately for us, they were able to cluster those into 9 lupus signatures. So they created this personalized molecular portrait for individual patients. They then validated their model. This is a theme in most machine learning models, is that they have training data and then they have additional data that's used to validate it. So they had 2 longitudinal cohorts, they had 3 cohorts of clinical data, and they actually had 1 data set with data with drug response information. They put this all into the machine learning algorithms to create prediction models. And what they developed was actually a web-based tool. So now MyPro SLE exists. The website's up and running. You can go and look at it if you want to. The trick is that you actually need this lupus patient transcriptome. So you need this profile of proteins from individual patients. Then you can put that information in and it will calculate out these 9 different profiles based on, these are all different parts of our immune system function. And some patients will be high in some and low in the others. And this is used to predict clinical outcomes. So for this patient in this example, you can see that the things in red are the bladder and the muscles. The things in orange, still highly likely to occur, would be kidney disease, hematologic disease, fevers, and ulcers. And the things that are much less likely for this patient would be things like lung involvement or heart involvement. There's no color associated with those. So this patient's profile predicts what organ manifestations they might have going forward. I think there's still a lot of questions about how reliable this is and if it applies to all different groups of patients or if it was really specific to the ones who are part of the development of the modules. But it's really exciting to me that we should be able to get to this more precise measurement and prediction of different organ manifestations and potentially different treatment options for patients based on their own immune cell function and dysfunction. I think that was everything I wanted to talk about today. I know I kind of flew through things. This is their conclusions, and that's the website from MyPro SLE. That's the end of my slides, but I just wanted to give everybody a flavor for what's coming down the road in terms of what computer algorithms are going to help us to be able to do in terms of improving care for patients with lupus. I'm happy to answer questions, though I'm actually not a machine learning expert. I think there's lots more that we should all learn about in terms of how these computer programs are going to be helping us or what cautions we need to have with them. But I do think it's a really exciting advance in science that's likely to be really helpful. These are a couple of different references. That's the detailed information about MyPro SLE, as well as the review article if you're interested more in machine learning models. There's lots of really interesting courses and YouTube videos and things about machine learning online as well. Hope that was interesting for everybody. I know it was a bit of a different flavor. I'm happy to answer any questions, both about this and about anything else about this. Thanks very much.